Hi, I'm Dr. Rose Hollow. I'm a board-certified naturopathic doctor, and I practice traditional naturopathy here at Deep Roots Wellness. We're a holistic mental health practice, so I see both folks who come for mental health services, and I also see people from the wild like you who just come in and want to work on their health. So welcome to my channel. Thank you for watching today. I'm sure you have a busy day like all of us do, so it means a lot to me that you're taking some time to learn something new and doing something good for yourself. So good for you. I should note that my videos are never meant to diagnose or treat anything. This is just for educational purposes only. And if you need the help of a professional, I suggest that you seek one. So today I wanted to talk to you guys about estrogen, progesterone, mast cells, and histamine. So this can be anything from like a really serious mast cell activation disorder to anything like your run-of-the-mill environmental seasonal allergies and things like that. And I have been seeing a lot of chit chat on the internet and in health support groups and things like that lately about allergies, about mast cell stuff. And I think this time of year it does increase because we are, well, here in Ohio, we're in spring now, which is amazing. I love spring, but I too have seasonal allergies, and I believe this is directly tied into my own estrogen dominance challenges. And I'm seeing this in my clients too. And it's not just adults and it's not just women, it's men and it's children too. So this can affect anybody. So we all live in these complex bodies, and we know they're complex, they're complicated. And you know, I sit and wonder sometimes, you know, it's like this miracle happens every day that we wake up and we're alive, and all these tiny processes happen in our bodies every day. They're just like the simplest of things, but there's so many things that happen in the process of a day that keep us alive, you know, and keep us functioning. And sometimes these things go awry. Sometimes these systems don't really want to work very well together. And you know, when you sit down and you start to learn about holistic health and natural health, you really start to see how all of these things on the outsides of our bodies and on the inside are so interconnected. So I see this with mast cells, with histamine and allergies and our immune systems, and how the outside world is affecting our hormones and our hormone balance. Again, very complex, but I'm going to try to make this as simple as I can today because I want to keep the video short for you guys. So my nerdy brain will try to do that. So your hormones basically are part of your immune system, and your hormones can affect your mast cells. So mast cells are cells that release histamine, and that's where we get a lot of our symptoms. Anything from anxiety and panic attacks to sometimes some chronic pain conditions can manifest from these, PMS symptoms, people who have autoimmune conditions can get flares. I see this in behavior. A lot of times it really shows up in little kids. People who have addictions or alcoholism. I've seen a connection to all of these things show up as symptoms of increased histamine, which is really crazy, right? In addition to, like, today I have, like, I'm stuffy, and you can probably hear it. That's how my stuff shows up. So anyway, so hormones affect mast cells, and mast cells have receptors on them for progesterone and estrogen. Mind blown, right? So these little cells that like to release histamine, they have these little plugs, like a little wall socket almost, where the estrogen and progesterone molecules are looking for a place to plug in. And and it's like a cycle, and I'll explain that in a minute. So estrogen dominance, which I have another video on that. If you wonder if you have some symptoms of estrogen dominance, go and watch my other video about estrogen dominance after this to see what that's about. Estrogen dominance could be contributing to mast cell activation and histamine intolerance. And I forgot to mention that this could show up as food intolerances too. So like people who are really sensitive to foods, but they don't have a true food allergy, or maybe they do, that can show up in that way as well. So it's very complex. So estrogen is a mast cell trigger when it's out of balance. So I always think of a scale, and I think of estrogen on one side and progesterone on the other side. And it's not really if one level is high and one's low, or they're both low. It's how they're balancing each other out that matters. So estrogen stimulates mast cells to make more histamine, along with other mast cell mediators. And histamine plays a major role in hormone balance. And that's how this wheel starts to turn. Like, this is where things start to get out of hand for a while. So for example, I had black mold in my house that I was living in, and 3 years ago I got very, very sick. And I know I've talked about this in my other videos somewhat, but the other people in my house and the pets in my house did not get as sick as I did. And I believe that that's because I was exposed to the mold already in a state of estrogen dominance. So I became even more sensitive to the mold, and the mold created more mast cells that were creating more receptors for estrogen, and it just got out of control. It got out of control for me, and I have lab tests to back all that up. I'm not just theorizing here. I've gone through a lot of testing, so I can say that that was a big issue for me, and that's how that loop starts, and it starts to feed on itself. So estrogen causes mast cells to release histamine, and the rising histamine levels produce more estrogen, and then the loop comes back again. Estrogen triggers the mast cells, and so on and so on and so on. So the other thing to know is that estrogen can reduce the DAO enzyme, which is, it's a big word, it's diamine oxidase, and that's produced naturally in your body that helps to break down histamine, but estrogen lowers the amount of DAO in your body. So if your body isn't producing enough DAO to keep up with the histamine, that can lead to histamine intolerance, and that's where we start to we go into histamine intolerance, and then we go into some of these mast cell activation syndrome sort of bucket of symptoms. And we have to remember that estrogen dominance isn't just about having elevated levels of estrogen. It's about having an imbalance of hormones. Again, it's not how high your estrogen is necessarily, but how it's balancing with other hormones. And the big one is progesterone. That's a huge, huge deal. So I would really encourage you to go back and watch some of my other videos about estrogen dominance and progesterone if you're confused about that. So when estrogen and progesterone are in the right ratio or balanced correctly, progesterone is counterbalancing estrogen, if that makes sense. And progesterone helps to stabilize mast cells, and progesterone helps stop mast cells from making histamine. So that's very, very important information. And when I'm talking about progesterone, I'm not talking about progestin or Premarin or any of the things that the conventional physicians are prescribing. I'm talking about bioidentical progesterone. So there's a big difference there, and I want to make that really clear, that if we are supplementing, we are supplementing with bioidentical progesterone. Because I know a lot of you are like, okay, that's my key. I'm going to stop watching now, and you're going to turn this off, and you're going to go ask for progesterone. You need to make sure that it's bioidentical progesterone, okay? If you're turning this off right now. So if you want to continue with me, hang on, I've got more information. So progesterone sends a signal through the mast cell hormone receptors to basically chill out. It says, calm the F down. I've got this. Progesterone is amazing, right? This is a big reason the estrogen progesterone balance is so important. Supporting your progesterone will likely help your histamine levels. And the reason I say this, and I'm confident in saying this, is because there is research on this. If you get on PubMed, you can look this stuff up. It's amazing. And there are quite a few clinicians, both conventionally trained, integrative physicians, functional practitioners, holistic practitioners, traditional naturopaths like I am, that are trying this out with their patients and clients, and they're seeing good results. And I also do this for myself, which was a big part of my mold recovery, was getting on some bioidentical progesterone. I use it with family members and friends. I feel very confident that there's this connection here, and I see great results with it too. So supporting your progesterone levels may, and I think my opinion is that they probably will help with your histamine levels. So I know I get a lot of questions on these videos, and I'm guessing that probably one of the questions is going to be like, well, why do I have an increase of mast cell problems, or racing heart, or sleeplessness, or runny nose, or whatever, panic attacks? Why do I have these only during certain times of the cycle, of my menstrual cycle? If you're a woman with men and children, this may not apply. But some of these problems tend to happen around the time of ovulation, and that's true for me too. That's when the ovaries release the egg, or at least when your ovaries are trying to release the egg. That's when our estrogen levels peak. And for some people, this could be the only part of your cycle that you're estrogen dominant. It just depends on you and your own hormone levels and what they're doing and how they're fluctuating. The other time that people really tend to struggle with this, if it's hormonal related, you'll notice that your symptoms get worse a couple days before your period starts, or a week before your period starts. And then after you get your period, things can kind of tend to settle down. Now, for me, when I was living in mold, this was not true for me. My symptoms were actually worse after I got my period, because it screwed up my hormones so badly. I was so out of balance that my whole cycle was so out of balance. So if this isn't true for everybody, it really can happen. But the thing is, if this is happening due to your cycle and your hormones fluctuating, you should start to see a pattern after a while. And I did. I tracked my hormones for 2 or 3 months, and I was like, okay, doctor. I had an integrative doctor who picked up on this for me. Said, I'm seeing this directly related to my cycle, and it's not making sense because my estrogen's higher during this certain time, but it's still correlating. So maybe this makes sense for you. I hope that this video helps somebody. So what do you do now? I think the best thing to do, if you think that this is a problem for you, is to consider trying, you could try a trial of bioidentical progesterone. Again, I'm not diagnosing or treating anybody here. I'm just saying what I suggest for my clients a lot of times. I really like Ona's brand. This is one that I feel comfortable using on even men and children. It's the Luna Pro 5, and it's a 50 milligram, and it has about a 12-hour half-life, I think. So I usually find that people do better dosing this at least every 12 hours. So say like when you get up in the morning, when you go to bed, have a little bite to eat, have some healthy fat with it. That may help. Now, that's a low dose. I know for a lot of people, they think 50 milligrams is high, but in the world of estrogen dominance, which is really what we're talking about here, and like severe histamine problems, people tend to need more than this, is what I'm finding, and I have found for myself. People tend to need a lot more, a higher strength, and maybe to dose it more often than twice a day. So this is where your practitioner comes in as your friend to help you kind of figure out how to do this. But now that I've maybe piqued your interest, definitely go back and watch some of my other videos. And there is a great group online on Facebook called the Estrogen Dominance Support Group. Super amazing resource. The people there over the last 3 years have helped me so very much, and I owe a debt of gratitude to those women and those practitioners in there that are offering free advice. It's a wonderful group. So I hope that this video was helpful for you, and thank you for giving me a little bit of your time and attention today. If you like this video, please like it. Please subscribe to my channel if you want to watch more videos. Please feel free to ask questions. And if you need a discount code for Ona's bioidentical progesterone, leave me a comment and I'll make sure that you get a discount code for that as well. All right, thank you.